Hello guys, welcome back to my YouTube channel. It's your girl DOBI. Thank you for clicking on that link and joining me today. Today, we want to welcome all those who are here for the first time. You're very welcome. Kindly smash the red subscribe button to follow more of my videos subsequently. Sexually transmitted infections are quite common amongst individuals who are sexually active worldwide. Amongst the causes of these infections, there are three main germs: chlamydia, gonorrhea, and syphilis. But recently, chlamydia as a cause of sexually transmitted infection is on the rise, and that is why today we are going to be focusing on chlamydia. Those who have a higher chance of acquiring this germ, the signs and symptoms, how do you know you have chlamydia, how it can be treated, and the possible complications that can arise from having chlamydia. Firstly, what is chlamydia? Chlamydia is a germ known scientifically as Chlamydia trachomatis. Chlamydia trachomatis. It is mostly gotten through unprotected sexual intercourse. And when you contract this germ through unprotected sexual intercourse, it does not end only at the vagina. It has a tendency of going upwards to the womb, to the fallopian tubes, and to the ovaries. That is why this germ is really very problematic. But who are those who have a higher chance of having this germ? Generally, it is people who are sexually active and carry out unprotected sexual intercourse. And it's been shown that it's common among the young people, 15 to 29 years, and people who have multiple partners, or people whose partners have multiple partners. These people have a higher chance of having this chlamydia. How do you know you have chlamydia? For most people, they are going to have no symptoms. It's just going to be there silently, and you may never notice, except maybe you do a test in future or something. But for some other majority of people, they may have pain, abdominal pain, especially girls. Girls are going to present with this pain before their menses. Normally, most girls have menstrual pain, but that's usually about 2 to 3 days when the menses starts. But if you have contracted chlamydia, you may notice that you have this pain about 3 days before your menses starts. So there may be a likely chance that you might have had chlamydia. Also, you may notice that you may have an abnormal discharge from the vagina. It may be smelling, it may be green, yellowish, an abnormal discharge, and also the pain may be present. To confirm that a person is suffering from chlamydia, most times when you have these signs and symptoms, which are abdominal pain, the vaginal discharge, and maybe painful urination, the doctor is going to examine you, do a vaginal exam on you for the females, and most times this diagnosis can be gotten just by examination without necessarily going to the lab. The doctor may actually ask for some investigations like an ecography and so on, just to confirm. But most times upon examination of an individual, the doctor can say, oh, this person surely has chlamydia infection. Chlamydia has some complications. I'm going to list about 4 of them. Firstly, it can climb up from the vagina to the womb and to the fallopian tubes, where it does a lot of damage. In the fallopian tubes of a woman, it can be there producing no symptoms. The woman will not know that there is something in her body. Can cause the tubes to be blocked, can cause water to collect in the tubes, can cause pus to form in the tubes. And most women may only notice this when they are trying to conceive after marriage. You notice, oh, I cannot get pregnant. You do some tests and some investigations, and you realize that, oh, madam, sorry, your tubes are blocked because maybe you had chlamydia 7 years ago, and so on. Also, even if both tubes are not blocked, there's a tendency that it makes one of the tubes blocked, and your baby, instead of getting into the womb, may end at the tubes, and this will result in what we call an ectopic pregnancy. An ectopic pregnancy, it means a pregnancy which is not in the womb but can be found anywhere. And because chlamydia destroys the tubes, commonly ectopic pregnancy is going to occur at the tubes. There are other many complications of chlamydia. If this pus is formed in the tubes, it can burst into your abdomen and cause what we call peritonitis. But I think the main burden of this germ is infertility. It is infertility which you don't plan for, maybe due to a sexually transmitted infection you had about when you were 17 or 18 because you're not properly treated. When you get married and you realize you cannot have a baby, it is actually very traumatizing. The complications of chlamydia are enormous and cannot all be listed in this video. So if you know someone who has suffered from a serious complication of chlamydia which we have not listed here, kindly drop a comment in the comment section below and we shall continue discussion there. What is the way forward? I think the way forward is prevention. Like we say, prevention is better than cure. How do we prevent this chlamydia? Firstly, is for us to have safe sexual intercourse, e.g. by using condoms during sexual activity, and also by doing screening for sexually transmitted infections every 3 months in our relationships. Last but not the least, by carrying out these tests for sexually transmitted infections before entering into a relationship and before marriage, so you know both partners are, at least at that moment, clear of sexually transmitted infections. And I think that will go a long way to prevent this disease and its complications, and we'll all be fine. Is there a treatment for this condition? Yes, there is. If the infection is so severe, someone suffering from chlamydia can be admitted, given antibiotics by vein, and then discharged home to continue on tablets. And for most cases, if treatment is followed both for the individual and his or her sexual partner, most cases can be treated. But if there is a breach in treatment, most times the chlamydia will just lie there dormant and causing more complications than we expected. So guys, please, we can continue the discussion in the comment section. Kindly drop your ideas, your opinions, your questions. I'm going to continue the conversation in the comment section below. Thanks very much for watching till the end. I'm so happy you stayed with me to the end. And please don't leave without giving a thumbs up, clicking the red subscribe button, and dropping a comment in the comment section below. We're together, guys. Thank you very much. Ciao.